So I apologize for those of you that I'm sure you've gotten a wealth of information today and probably would have appreciated a break. But I do have some other things on my calendar. We are in Medicare open enrollment, so it's a very busy season for us. So I apologize for that. But if you do need to take a little break, feel free to do so, and you can come back in. And I will share these slides with Zandra and Jamian so that you can have them as well. But my name's Rebecca Gowdy. I am with the West Virginia Bureau of Senior Services. I oversee our Medicare programs in the state. So these are federally funded programs here to assist you with Medicare. So we're here to help you walk through all of the steps of Medicare, understanding your different Medicare options, and helping you get the coverage that you feel is best for you. One of those programs is called the SHIP program, which stands for the State Health Insurance Assistance Program, and it is a federally funded program through Congress. It's overseen by the Administration for Community Living, and there is a SHIP program in every state and 4 territories. So if you happen to plan to move after you retire, or if you have friends or family in another state who have Medicare questions, you can visit the website shiphelp.org to find the SHIP contact information for another state, but there is one in every state. Each one is set up a little bit differently. Some will be in the Department of Insurance, some will be in the Department of Aging. In West Virginia, we are in the Department of Aging, the Bureau of Senior Services. And then we have counselors located around the state at our county aging providers or senior centers and our aging and disability resource centers here to assist you. And we help you navigate through all the different parts of Medicare. So there's lots of components to Medicare, and we will go over some of these at a high level. So Part A, B, C, D, and the Medigap or supplement plans. We can also help low-income individuals apply for assistance with their Medicare costs. There's programs to help with the Medicare premium and prescription costs. And at the bottom of this slide, you can see our toll-free number. So you can call that number or visit our website, wvship.org, to get in contact with a counselor. If you don't have this presentation later on, our phone number is also always printed on the back of the Medicare and You handbook. So once you are on Medicare every year in the fall, you'll get a Medicare and You handbook. And if you flip it over to the back cover, you'll also find our toll-free number there as well. So as I mentioned, we're going to go over some of the different parts of Medicare. Most people understand that Medicare is health insurance, but it is health insurance for certain groups of individuals. The largest and most common is that for those 65 and older. So that's what most people think of when they think Medicare is older adults. But then you can also get Medicare if you are receiving Social Security disability. So after 24 months of receiving Social Security disability benefits, you do become eligible for Medicare. The only time you do not have that 24-month waiting period is if you have ALS or Lou Gehrig's disease. Then you get Medicare as soon as you start receiving your Social Security check. And then the third group of people on Medicare are those any age with end-stage renal disease, meaning that they're receiving dialysis services or on a kidney transplant list. And so there can be people of any age on Medicare, just depending on their circumstances. In West Virginia, we have about 440,000 Medicare beneficiaries, and about 25% of those are on Medicare either due to disability or end-stage renal disease. There are different federal agencies involved with Medicare. Social Security is involved with the enrollment into Medicare and the premium collection. So when you are ready to sign up for Medicare, you are going to contact Social Security, or you can go to Social Security's website, Social Security or ssa.gov, to apply for Medicare benefits. So they handle the enrollment into Medicare. And then there is a cost for Medicare, and so they handle the premium collection for the Medicare. That is all Social Security has to do with Medicare. So they're not going to be able to answer questions about what Medicare covers, plan options. If you're experiencing issues with your Medicare, Social Security is not going to be the agency to go to. They just handle that enrollment component. If you or your family happen to work for the railroad retirement or the railroad, then you would go through the Railroad Retirement Board for your Medicare. So they handle the enrollment and premium collection of Medicare for railroad retirees only. And then if you or a family member worked for the federal government, then the Office of Personnel Management might be involved with your Medicare. The last agency on this slide is the Centers for Medicare and Medicaid Services, or CMS. That is the federal agency that handles everything else with Medicare. So they're going to determine what the cost of Medicare is, what services are covered, what the cost of those services are covered. They are the ones that approve what plans are allowed to be marketed in different areas. So they're the ones that handle all the other aspects of Medicare outside of enrollment and premium collection. Now with Medicare, oh, sorry about that. If you are drawing your Social Security benefits prior to the age of 65, you will be automatically signed up for Medicare. So you don't have to take action to sign up for Medicare. Or if you're drawing the Social Security disability benefits, you will be automatically signed up for Medicare that 25th month of disability. So you don't have to do anything. So that's if you're drawing early retirement, if you're drawing widow's benefits or disability benefits prior to 65 or that 25th month of disability, you don't have to take any action. You should get your welcome packet about 3 months before your birthday month. It'll have your Medicare card in it, which you can see on the slide, which is oftentimes referred to as the red, white, and blue card. And it'll have a brief explanation about Medicare and the different options. But for a lot of people, they are going to continue working beyond the age of 65, and so they are not drawing Social Security benefits. If you're not drawing Social Security benefits and you need to sign up for Medicare at age 65, then you have to take action to sign up for the Medicare coverage. And you have a 7-month window around your 65th birthday to do that. So you have 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. If you sign up in the 3 months before your 65th birthday month, your Medicare will start the first day of your birthday month, unless your birthday is the 1st. So let's say that your birthday is December 1st. If you sign up in the 3 months before your birthday month, your Medicare would actually begin November 1st. But for anybody else whose birthday is the 2nd through the 31st of the month, your Medicare would start the first day of your actual birthday month if you sign up in those 3 months before. If you sign up the month you turn 65 or 3 months after, your Medicare will begin the month after you sign up. So again, let's say your birthday's in December and you sign up in January, your Medicare would start in February. So it just starts the first of the following month. Obviously, the sooner that you do it, the sooner you're going to have your card and have everything in place, ready to go when you turn 65. So I do recommend that you sign up early in that 3-month period before you turn 65, but you do have this full window. Now, there can be times that you don't need to sign up for Medicare at 65, depending on if you have other health insurance and whether it's based off of active employment and the size of the employer. So that's what this slide shows here. So if you're 65 or older and you have only retiree coverage, Medicare's your primary, you need to have Medicare A and B. If you're 65 or older and you have active employer health insurance through yourself or a spouse, and your employer has fewer than 20 employees, Medicare is going to be primary. You need to sign up for Medicare A and B. However, if the employer has more than 20 employees, then you can choose to delay signing up for Medicare until you or your spouse is getting ready to retire. And then if you have Medicare due to disability and you're covered by active employer health insurance by yourself or your spouse, the employer, if they have more than 100 employees, then the employer insurance remains primary. Less than 100 employees, Medicare is primary. Now for the conference, it is the size of your church. So if your church, if you have insurance through the conference and not a spouse, and your church has less than 20 employees, then Medicare is going to be your primary. You need to sign up for Medicare. If you have more than 20 employees, then the conference insurance would remain primary, and you can choose delaying signing up for Medicare. So there's lots of different parts to Medicare. And we'll go over all of these different parts, but the original Medicare, what you're signing up for at age 65, and where everybody has to start off is original Medicare. That is your Part A and Part B of your Medicare. And that, again, is what's going to show on that red, white, and blue card. Part A is your hospitalization insurance. Part B is your medical insurance. Then you can choose to add on or get other coverage to go along with your Medicare if you choose. And we'll go over those different add-ons that you can select. So again, with original Medicare, you have Part A and Part B. Part A is your hospital insurance. And for most people, Part A is premium free because that is what you've worked and paid your Medicare taxes to. Or if you did not work, but you're married and your spouse worked, then you can draw benefits off of your spouse and qualify for Part A premium free. So it's very rare that somebody would have to pay for Part A. But if you don't have the work history and you are not able to draw off of somebody else, you can purchase Part A. It's expensive. I think $505 a month right now, but you can choose to purchase it as long as you're 65 or older. There is a deductible under Part A for hospital coverage. If you're inpatient in the hospital, there is a deductible of $1,632 per benefit period right now. That's the 2024 amount. The 2025 amounts have not been announced yet, so that will probably change a little bit for 2025. But right now, if you just had original Medicare, you did not take out any other health insurance, and you were to go into the hospital, you would have to meet that deductible first per benefit period. And a new benefit period starts over when you've not been in the hospital or skilled nursing facility for 60 consecutive days. Part A also covers skilled nursing facility care if you have a qualifying hospital stay, and can cover home health care depending on the situation. And then Part A always covers hospice care. So if you need hospice benefits, you're going to get that under your Part A. Part B is your medical insurance and what I call your everyday usage of your Medicare. This includes all doctor services, outpatient hospital services, including the emergency room or urgent care, lab work, MRI, CT scans, durable medical equipment, and preventive services fall under Part B. Part B does have a monthly cost to it, which we'll see on the next slide. And then it does also have an annual deductible, which is currently $240. And then after that, it is 80/20 coverage if you just have original Medicare and no other coverage. So here we can see the Part B premiums. Again, this is for 2024. They have not announced the 2025 premiums as of yet. The current premium, base premium, is $174.70, but it is based on your income. So they look 2 years back. So right now they're looking at your 2022 income to determine what your premium would be. If your income was higher than $103,000 as an individual or $206,000 as a married couple, you would have to pay a higher Part B premium. And this is referred to as the income-related monthly adjusted amount. This is reevaluated every year. So in 2025, they'll look at your 2023 income and so on. And then if you have had a reduction in work or you have stopped working and that has significantly decreased your income, you can also ask for reconsideration. That would be done with Social Security because, again, they handle the premium collection. So that's who you would ask the reconsideration from. So again, these premiums are likely to change for 2025, but we don't know yet what they are. However, you can see in the upper right-hand corner, they have announced the Social Security cost of living adjustment raise for 2025. It will be 2.5%. So that has been announced. We're just waiting on the Medicare 2025 costs now. So there are different options that you can get to go along with your Medicare to help with the costs. And one of those options is a Medicare supplement or Medigap policy. And supplement policies are sold by private companies to work to fill the gaps with original Medicare. So the Part A deductible that we just saw, the 20% coinsurance that Part B has, that's what these plans are working to help pay. So you would have very little out-of-pocket costs if you do a supplement plan. although it has a monthly premium to it. So you would have to pay an additional premium for this coverage along with your Medicare A and B. You would have this cost, but you don't have to worry about medical bills when you get medical services. You don't have to worry about a network. So you can go anywhere that takes Medicare. They must take your supplemental policy. And you don't have to worry about prior authorization because if Medicare pays, the supplement policy is going to pay. There are different plan letter types, and we'll see that on the next slide that you can choose from. And it depends on what plan that you choose, how much coverage you're going to get. There are only certain time frames that you can get a Medigap policy. So you have 6 months from the time you're 65 or older and have Part B. So you have to meet both of those criteria, both be 65 or older and have Part B. You would have 6 months to get a Medigap supplement policy where they cannot look at pre-existing health conditions. Outside of that window, they may be able to look at pre-existing health conditions and choosing whether or not to sell to you, except in limited circumstances. It is time sensitive of when you could get a Medicare supplement or Medigap policy. Now, the conference does offer a Medicare supplement policy that works similar to these Medigap policies I'm speaking about. Although one thing about the conference supplement is that the premium is not based upon age. It is the same premium regardless of how old you are on the coverage. Whereas with the supplement policies that you may choose to purchase through a private company and not through the conference, those plans will increase as you get older. These premiums are going to be in the $100+ range, so they are not inexpensive. So they may not be an option for everyone. It really depends on your circumstances, what you can afford, but realizing that these pay what's left over for you, so you're not having to worry about out-of-pocket costs. So you have to decide what you feel is most beneficial to you, and that is something that we as SHIP can help you navigate through. We can help explain that in more detail, provide more personalized information about costs so that you can make that decision of what you feel like is a best fit for you. So here are the different Medigap plan policies. There's plans A through N, although there are some letters missing because they're no longer available. Plan G, as in girl, is the most commonly chosen plan type right now. Plan G covers all out-of-pocket Medicare expenses, as long as Medicare covers the service, except for the Part B, as in boy deductible, which is $240 currently. So you would pay the first $240 worth of medical services, and then after that, the Plan G pays the remaining cost for you. If somebody is not looking at a Plan G, they oftentimes will look at a Plan N, as in Nancy. Plan N covers all Medicare covered costs except for the Part B deductible as well, and then up to $20 for office visits, $50 for the ER. And then if you go to a provider who will take Medicare, but not the Medicare approved amount, they're allowed to charge up to 15% over the Medicare approved amount, and you would be responsible for that on Plan N. Let me go back here. Before we switch to the Medicare Advantage plans, one thing that I do want to mention with the Medigap supplement plans is that they do not include prescription drug coverage, and that goes for the conference supplement as well. So you would still need a separate prescription drug plan for your medication coverage, and we'll see more information about the Medicare prescription drug plans in just a moment. So an alternative option to the Medicare Advantage, or excuse me, the Medicare supplement plans is Medicare Advantage. Medicare Advantage is also called Part C. You don't necessarily need Part C. So a lot of times people will say, well, I need parts A, B, C, and D. You don't have to get Part C. It is completely optional coverage. It's an alternative way to get your Medicare coverage. So you can either stay with just original Medicare A and B. You can do Medicare and a supplement policy, or you can do a Medicare Advantage. So those are kind of your three pathways that you have to choose from. Medicare Advantage, again, is another way to get your Medicare coverage, but is still part of the Medicare program. It's just run by run by private companies. You do still have all your rights and protections like you would with regular Medicare, and you still have access to Part A and Part B services. Now, when you do Medicare Advantage, you do still have to pay your Medicare Part B premium. So that's a question that we get a lot is that, oh, well, if I do this, I'm not getting my health care through Medicare. I'm getting it through this private company. I don't have to pay for Part B, right? No, you still have to pay your Part B premium, even if you do Medicare Advantage. Because Medicare pays so much a month to the Medicare Advantage company to manage your care, and then Medicare doesn't pay on your bills. It's all done through the Advantage Plan company. With Advantage plans, you are going to have networks that you have to use. So you do have to pay attention to that network and make sure that your doctors and hospitals accept the Advantage plan that you're interested in. And they're going to have their own co-payments, co-insurance for services. So you will still have out-of-pocket costs if you do a Medicare Advantage plan. You are still going to pay something when you go to the doctor, hospital, lab work. All those services are still going to have co-pays to them. It's just going to be a set defined amount by the Advantage plan instead of the 20% that you might have with original Medicare. And again, that is something that we can help you look at. Most Advantage plans do include prescription drug coverage with them, so you don't need to get a separate prescription drug plan for your medicines. And then they can include extra benefits like some vision and dental coverage, although it varies how much vision and dental is covered. It may not be that much depending on the plan that you select. So it's really important that you look into that. If that's what you're interested in the most with an Advantage plan or those extras, you really want to look at what those are with the particular plan because they may not be what you think they might be. Okay, I saw a chatted question come in and they were asking about the conference supplement and what lettered plan type it is. So it's not actually a lettered plan type because it is an employer provided plan. It doesn't have to follow the standard letters, but it is most similar to Plan G. So that would be the one that I would say that it's the most similar to is Plan G as in girl. Right. So with the Medicare Advantage plans, there are different plan types available. So there's health maintenance organizations, preferred provider organizations, private fee-for-service plans, and what those mean is that determines the network and how the network works. So with the health maintenance organization or HMO, you cannot go out of network. You must remain in the network. If you go out of network, you will pay 100% of the cost of the service. Also with an HMO, you have to get a referral from your primary care doctor to see a specialist. So it is going to be a little bit more restrictive type of coverage. A preferred provider organization or PPO will allow you to go out of network. You may pay more if you go out of network, but the plan will also pay some, and you don't need a referral to see a specialist. Private fee-for-service plan works very similar to a PPO. And then we have special needs plans. Those are going to be for certain populations. And in West Virginia, we only have special needs plans for two groups. One group is those who are Medicare and Medicaid. And then the other is for residents of certain nursing homes. So those are the only two types that we have. A lot of times you might see advertising about Medicare Advantage plans that talk about flex cards or grocery assistance. That is typically only available on the special needs plans for people with Medicare and Medicaid. So just be aware of that. A lot of times that is used as a marketing tool, but it's not necessarily available to everyone. And not every type is available in all areas. So Medicare Advantage plans are zip code county specific. So what's available in Kanawha County is not necessarily what's available in Barber County or Brooke County. It just varies from county to county what's available. And that can also change from year to year. So while you may get one plan this year, it may not necessarily be available next year, or it might look different for next year. And so that is something that you would want to reevaluate every year to see if that plan is still a good fit for you. Now, like I said, you do still have to pay your Part B premium. There are a few plans that will pay a portion of that premium for you. There's very few, at least in West Virginia, and none of them will pay all of the premium for you. So that is something just, again, to keep in mind. And then the Medicare Advantage plan may also have an additional premium. There are some that are zero premium, but then there are some that have a monthly premium. The monthly premium for an Advantage plan is typically lower costing than a supplement Medigap policy. But again, you do have co-payments, co-insurance, and potentially deductibles still with the Medicare Advantage plan, depending on the plan that you select. So when can you join a Medicare Advantage plan? You can have that 7-month window around the time that you become eligible for Medicare. So the 3 months before your Medicare starts, the month your Medicare starts, and 3 months after. Then you have open enrollment every year, which is this time of year. And what I said, we're very busy this time of year, because everybody has the opportunity to reevaluate their coverage and make changes to their coverage. And as I mentioned, the plans can and do change from year to year. So you do want to review your coverage every year to make sure that that plan that you have is, number one, going to be available for the next year, and number two, is still meeting the needs that you have. So I do strongly encourage you to take advantage of open enrollment. Then you have special enrollment periods. So if you are covered by an employer plan, maybe you're covered by your spouse's employer plan, and they're going to retire June 30th, that would give you a special enrollment period to sign up for an Advantage plan at that time. Or if you move out of your service area, so if you move from one county to another and your plan's not available, or of course, if you move to another state, your plan's not going to be available, you would have a special enrollment period. If you're in a nursing home, you would have a special enrollment period to change plans. And then there are also what's called the Medicare Advantage open enrollment period, where every year, January through March, you have the opportunity to change your plan one time. So it kind of gives you a trial period to give it a try, see if you like it, and if not, you could change one more time. So you could switch from one Advantage plan to another, or you could go from Advantage back to original Medicare and pick up a prescription drug plan. So if you sign up for an Advantage plan during the open enrollment season, and then you find out it's not a good fit for you, or maybe you did not review your plan during open enrollment and then find out it's not a good fit for you, you do have that window to make a change. So deciding on whether you or not you should join a Medicare Advantage plan is going to depend on what are the extras that it might offer. Is that really something that you were expecting or needing? Evaluating the network. That is very important that you make sure that your doctors and hospitals are in the network. Do you need a referral to see a specialist? Realizing you can only change plans at certain times of the year, and then that it does not work with a Medigap or supplement policy. So this is an either or. So you either do a supplement or you do Medicare Advantage. You cannot do both. All right. And then the last part is Medicare prescription drug coverage, also called Part D as in drug, the only part that makes sense. These are run by private companies, but are approved by Medicare. Prescription drug coverage is optional. You're not required to get prescription drug coverage, but if you don't, you may owe a late enrollment penalty later on for not signing up for prescription drug coverage. All of the prescription drug coverage have formularies, which is a list of medicines that they cover, as well as restrictions that they could potentially have on medications like prior authorization or quantity limits, where you have to go through some authorization before a particular medicine might be covered. So every plan is going to have that. And so that is why it's really important to evaluate your current medications in choosing a plan to find a plan that best fits your needs. Now, of course, your medications could change throughout the year. And that's why, again, we have open enrollment that you can make changes to your coverage as needed from one year to the next. You do have to actively enroll to join a drug plan. It's not going to be done for you. And you can get drug coverage either as a standalone prescription drug plan to work with original Medicare or Medicare and a supplement, or you can get drug coverage built into a Medicare Advantage plan. Now, one thing that's changing for 2025 is the prescription drug coverage structure. So this is part of the Inflation Reduction Act that was passed by Congress a few years ago. But what happens is when you join a drug plan, starting out, if your plan has a deductible, you have to meet your deductible. Or if that deductible doesn't apply to your medicines, then you don't have to worry about that. or if your plan doesn't have a deductible, then you just move immediately into the initial coverage phase. At that point, you're paying whatever your co-payment or co-insurance is for the medication. So whatever is specified by the plan for that particular medicine based on the tier level that it is, you pay that price. Up until you've paid out of pocket $2,000. Once you've paid out $2,000 in prescription co-payments for covered medicines, then you reach catastrophic coverage and your medication costs go to zero. So you pay no more for the cost of the medicines. It is only for covered medicines that $2,000 cap happens, and the zero cost, again, is only for covered medicines. So if you are taking a medicine that's not covered by your plan, that will not apply to the $2,000 cap and the zero copay after the cap. But this is an enhancement for 2025. Other changes implemented from the Inflation Reduction Act include insulin being capped at $35 per month supply. Now that is actual insulin. The once weekly diabetic injections are not considered insulin. So Ozempic, Mounjaro, Trulicity, those are not insulin. So they are not part of that $35 cap. Also, all commercially available vaccines are available at no cost as long as you have prescription drug coverage. So shingles vaccine, whooping cough, RSV vaccine, you can get any of those at no cost. Flu shot and COVID shot or vaccine are covered under Medicare Part B as in boy as a preventive service, and they would also be available at no cost. And then I mentioned the $2,000 cap is being implemented in 2025. And then another thing that's being implemented for 2025 is the Medicare prescription payment plan, where you can spread your costs out over the year. So instead of paying a large amount in January, if you have high cost medications that are subject to a deductible, you can choose to spread those out over the year and be billed for your co-payments over 12-month time frame. So just like you can put, a piece of furniture or a car on a payment plan and make payments to that, that's what you're going to be able to do with your prescription costs. If you so choose. It's completely optional, and it is something that you would elect through your drug plan, whoever you have for your drug coverage. And if you are wanting to know more about what those costs might be, that's again something that we as SHIP can help you evaluate. And then another or last thing here is about colorectal cancer screenings. So by 2030, those will be zero coinsurance for any colorectal cancer screening, even if it's diagnostic and something's been found, a polyp's been removed, the actual colorectal cancer screening, the colonoscopy, would be covered at no cost by 2030. Now, if you remember when we talked about the Part B as in boy premium, I mentioned that if you had a higher income, you'd have to pay a higher Part B premium. The same thing applies for drug coverage. So if your income falls in a higher income bracket, you do have to pay a surcharge on prescription drug coverage as well. Again, this is reevaluated each year. So this is for 2024. It will change for 2025. And they look 2 years back. So 2024, they're looking at 2022 income, 2025, they'll look at 2023 income, and so on. And you can also ask for reconsideration on this as well. So when can you join prescription drug coverage? So again, that initial 7-month window, 3 months before your Medicare starts, the month your Medicare starts, and 3 months after. Open enrollment, again, critical time of year because the plans can and do change every year. So I strongly encourage you to take advantage of open enrollment every year and evaluate your coverage. And I've got a little bit more about that on the next slide. So I won't, or 2 slides from now. So I'll hold off on that. Again, we have the Medicare Advantage open enrollment period, January 1st through March 31st, that you can change plans one time. If you're on a Medicare Advantage plan, you can go from Advantage to Advantage, or you can go back to original Medicare and a prescription drug plan. Then again, we have special enrollment periods. If you move out of your planned service area, you're losing other credible prescription drug coverage, you are in a long-term care facility, you qualify for low-income assistance called Extra Help. You can change drug plans monthly starting next year, but you will not be able to enroll into a Medicare Advantage plan except during your initial enrollment period, open enrollment period, or a different special enrollment period outside of qualifying for low-income assistance. Now, again, open enrollment runs October 15th through December 7th, and this is the time frame that you can enroll into coverage, disenroll out of coverage, or switch coverage for Medicare Advantage plans and prescription drug plans only. So Medigap supplement plans are not part of open enrollment. And so I do have some information on here about the changes for 2025, and this may not pertain to you if you're not on Medicare yet, but I just wanted to include it so that you're aware of how that can change from year to year and why it's important to review every year. So for instance, our prescription drug plans, standalone plans for West Virginia, in 2024, we had 20 plans. In 2025, we'll have 14. So we had some plan reductions, some plan consolidations. Mutual of Omaha prescription drug plans are terminating completely for 2025. So anybody on that, those plans have to get a new plan for 2025. And then our Silver Script or Aetna drug plans consolidated from 3 plans down to 1. And that one plan may not be a good fit for you for the next year. So again, this is why we encourage people every year to review their plan options, review those changes to make sure that it's a good fit for them for the next year. We also have some Medicare Advantage plans that are terminating for next year. So we have 17 Medicare Advantage plans that are terminating in at least 1 or more counties. 36 counties are losing at least 1 or more Medicare Advantage plans. So we have a lot of people that are being impacted by that this year. And again, why I'm so busy. But this is just to let you know, there can be changes from year to year. And so please take advantage of this open enrollment season. You can contact us and we can help you. You can look online yourself at medicare.gov, the official Medicare website, or you can call 1-800-MEDICARE, which is open 24 hours a day for assistance. So there's lots of different avenues for you to look at that, but we are happy to help as we are able. Now, I mentioned about credible coverage when we were talking about special enrollment periods, if you're losing credible coverage. So if you do have credible prescription drug coverage, you don't have to sign up for a drug plan until that coverage is getting ready to end. Also, sometimes if you do sign up for Medicare drug coverage, you could lose your credible drug coverage. So for instance, PEIA, the state employee insurance, you cannot sign up for a Medicare drug plan or you will lose your PEIA coverage. So if you do have credible drug coverage available to you, you want to check, am I allowed to have Medicare drug coverage with that? Or is that going to cause me to lose that because you may not want to sign up for other coverage? As long as you have credible drug coverage that meets or exceeds Medicare's minimum standards, you would not be subject to a late enrollment penalty when you are ready to sign up for Medicare drug coverage. Employer group health plans, so active employer insurance, retiree plans that offer prescription drug coverage, the VA, Veterans Administration, TRICARE, and federal employee health benefits. / Postal Service health benefits, which will be starting in 2025 if anybody happens to be Postal Service. Now, if you do not sign up for prescription drug coverage when you're first eligible and you do not have credible drug coverage, then there is a late enrollment penalty for not signing up. It is 1% of the base beneficiary premium, which for 2025 is $36.78. So 1% of that is going to be just about 37 cents times the number of months that you were eligible but not enrolled. And so if somebody has been eligible for prescription drug coverage since Part D started in 2006 and has never signed up for a drug plan, which there's a few of them still out there, they're going to owe $82 extra a month if they were to sign up this open enrollment for 2025 coverage. So that penalty definitely can add up over time. It's about $4 and change for every 12 months that you're eligible but do not enroll. There is a zero premium prescription drug plan for 2025. So if you don't take any medicines, a lot of people are like, well, I don't take any medicines. Why should I sign up for drug coverage and pay for the coverage? Well, we will have a zero premium drug plan for next year. So that is a benefit. But even if we don't have a zero premium plan in future years, one reason that you want to sign up. And then also, we can never predict the future. We don't know what can happen in our life. And so something might change and you now need to get prescriptions. If you have prescription drug coverage, then at least you have some coverage. So again, deciding whether or not to sign up for a drug plan, a lot of that's going to depend on whether or not you have credible drug coverage. Again, sometimes you cannot sign up for a drug plan or you'll lose your credible drug coverage. You also want to weigh what are your drug costs versus the cost of the prescription drug coverage, but also weighing if you don't get a prescription drug coverage, there will be a late penalty potentially. Now, I mentioned that there are some low-income programs to help with prescription costs and the Medicare premium, and we can help people apply for those. So the first is the Extra Help program, which is a Social Security-based program that helps low-income individuals with their prescription drug costs. So it would help with your plan premium, deductible, and copays. And then there's the Medicare Savings Program through the state's Medicaid or Department of Human Services, formerly the DHHR, that help with that Medicare Part B premium, the $174.70 currently. So the income limit for the Extra Help program is gross before deductions, $1,903 for an individual, $2,575 for a married couple, but it is based on family size. So if there's additional relatives in the household who depend on you for financial support, that does raise the income guidelines. So if you have grandchildren in the household or other relatives, you may be eligible because of that. There are resource or asset limits. This is looking at your bank accounts, stocks, bonds, IRAs, 401k. The resource limit for 2024 is $17,220 for an individual or $34,360 for a married couple. And then these are the Medicare savings programs that help with the Medicare Part B as in boy premium. So these are the income guidelines. These strictly look at individual or married couple. They do not look at additional people in the household in determining the income guidelines. So again, we can help people apply for both the Extra Help program and the Medicare savings programs. All right, last little bit before I let you go. We do have another program that I oversee related to Medicare called the Senior Medicare Patrol, which is focused on Medicare fraud and abuse. So our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. Program through the Administration for Community Living. There is an S&P program in every state, but they're not always co-located like we are in West Virginia. So you can visit the smpresource.org to find the S&P contact information for another state. But here in West Virginia, we're still co-located. So we're at the Bureau of Senior Services. And then again, counselors located throughout our aging network at the senior centers and aging and disability resource centers. And we help Medicare beneficiaries, their families, and caregivers protect their Medicare benefits, detect suspected Medicare fraud, waste, or abuse, and report suspicious activity. So some of the biggest things that I can tell you is that red, white, and blue card, when you get that, you want to treat that like your credit card. Do not give that number out to callers that you just get a cold call from. Medicare does not call you. Medicare will never call you. They will not call you to see if you got your new card for next year. They will not call you to let you know your benefits are changing. Those are all scams trying to get that Medicare number because your Medicare number is very valuable. So that is a very important message that we want to pass on to all Medicare beneficiaries. Also, with Medicare, you do get statements on the services that you received called Medicare summary notices that show what services you had, what Medicare paid for, and what you might be responsible for. Sometimes you have no idea that your information has been compromised because maybe it was compromised as part of a data breach. And so it's out there. And the only way you know that fraud has happened on your Medicare is that you see that on your Medicare summary notice. So you may see charges for services that you did not receive. If that happens, we want you to contact us and report that to us, and we can help walk you through what needs to be done to get that removed and get it reported as fraudulent activity. Some examples of Medicare scams is that you get the call of asking about your Medicare number, but then they lead into, do you have back pain or knee pain? And they want to try and get a brace for you. And you might actually receive a brace in the mail, but it might be a $20 brace that you could have bought at the local pharmacy, whereas what's billed to Medicare is a $1,000 custom brace. Card scams are very big. So you get calls asking, did you get your new Medicare card for 2025? Or did you know that Medicare is going to plastic cards or they're putting chips in them? None of that is real. Medicare cards are heavy cardstock paper and they are not sent out annually. You get your card and you don't get a new card until you need to order a new one, unless your information was compromised as part of a data breach that directly connects to Medicare, like through a big provider office or a big claims processing center or something like that, then Medicare may send you a new card, but you would get it by mail. You would never get a phone call about it. Example of the charges that you might see on your Medicare summary notice for things that you didn't get: catheters, so urinary catheters. We've had people get their Medicare summary notice and now they had 6 months worth of urinary catheters charged to them, $200 a month. They don't use them, they never got them, but Medicare paid for them. So that's why we encourage you to review your Medicare summary notice. And then genetic testing, where you might get phone calls to see if you're predisposed to cancer or predisposed to allergies with particular medications. All you need to do is a cheek swab, but first we need that Medicare number. Do not give your Medicare number to unsolicited callers. Another thing they can do is make it show up on their caller ID as your doctor's office calling. So had this before where it might show up a major hospital network, and you might be expecting a call from them because you go to the doctors with that hospital network or you're trying to schedule a test, and so of course you answer it. But if they start asking about your Medicare number, hang up the phone. That's not correct. They should not be asking for that information, especially if it's for a doctor's office that you've already been to before and they already have that information. And you know what? If you're just not sure, go ahead and hang up the phone and call your doctor's office right back. They are going to be more than happy to confirm whether or not it was a scam or if it was really them, rather than you falling victim to a scam. Every year, $60 billion is lost to Medicare fraud, and that is billion with a B. And it hurts us all. So when there is fraud happening with Medicare that impacts the Medicare Trust Fund, which we want to be around, it impacts our health because the stress of, oh, I just compromised my information and now you're worrying about that. But it could also impact your health because you can't get services that you need. So another type of fraud that is happening is hospice fraud, and people are being put on hospice in error by fraudulent scammers to get money from Medicare. And when you go on to hospice, Medicare doesn't pay for all services anymore. So they may not pay for the open heart surgery that you need to have because now it's showing a hospice flag. So you just want to be really, really careful with your Medicare information. Protect your information. That might seem very simple for you, but that's what you can do. Obviously, we can't prevent all fraud that takes place out there. There's bad actors everywhere. There's bad actors, doctors and pharmacists that might be bad actors. We can't prevent that, but there are things that we can take steps to prevent. So here's my contact or our contact information for the SHIP and S&P. We have our website, we have our toll-free numbers. It really doesn't matter which one you call, you're going to get to us. Now, again, right now we are in open enrollment, so it is very, very busy for us. You're going to have to leave a message and you will get a call back. You're not going to get a live person to answer the phone right now. It's just the amount of call volume that we're getting with the amount of counselors that we have. We are also always looking for volunteers though. So if you would like to volunteer to help people understand their Medicare benefits or do educational presentations about protecting your Medicare information from fraud, reach out to us. Be happy to help you volunteer with our program. And then here is our contact information. And then I do see that somebody has their hand raised. I don't know
I see
if
a
there's a...
question that came in,
Okay.
Rebecca. Does Medicare cover the full cost of shingles and pneumonia shots?
Yes. So shingles would be covered under prescription drug coverage. So as long as you have prescription drug coverage with Medicare, yes. And then the pneumonia is covered under Medicare Part B as in boy as a preventive service at full cost. Yes, both of those. Yep.
Yeah, I don't see anything else in the question box
I
or
do,
that,
it
but
popped
please
up
take a
that said
look.
Deborah raised her hand, but I don't know if she's able to come off mute. Like, I don't know how you guys have it set up or not. So.
No, we don't have that set up.
Okay. All right. So Deborah, my email information is here as well as my phone number. So if you want to email me or call me with your question, I'd be happy to answer it. But that is everything that I have.